Ingrown hairs and razor bumps are a common concern for many, especially for those with curly or coarse hair textures. For people with black skin, these issues can be particularly persistent and sometimes lead to further complications like hyperpigmentation or keloid scarring. Understanding how to prevent and treat ingrown hairs and razor bumps, particularly after waxing and shaving, requires a combination of the right techniques, consistent care, and the proper products. Let's dive deep into everything you need to know to keep your skin smooth, healthy, and bump-free. First, it's important to understand exactly what ingrown hairs and razor bumps are. Ingrown hairs occur when a hair that's been removed starts to grow back into the skin rather than up and out. This can cause redness, swelling, pain, and sometimes even lead to infection. Razor bumps, medically known as pseudofolliculitis barbae, are a specific type of ingrown hair that often occurs after shaving, especially in areas with curly hair. The hair curls back into the skin, leading to inflammation, bumps, and sometimes pus-filled lesions. On black skin, the natural curl of the hair increases the risk of these issues, and the subsequent inflammation can sometimes lead to dark spots or scarring. To address this, prevention is always better than cure. Preparing your skin before waxing or shaving is the first critical step. Start by cleansing the area thoroughly to remove oil, dirt, and bacteria. This helps reduce the risk of infection if hairs do become ingrown. Next, exfoliation is key. By gently sloughing away dead skin cells, you're allowing the hair to break through the surface more easily, minimizing the risk of it curling back under. For exfoliation, consider using a gentle scrub or a chemical exfoliant. Physical scrubs with fine granules can help, but they must be used gently to avoid irritation. Chemical exfoliants containing alpha-hydroxy acids, AHAs, or beta-hydroxy acids, BHAs, like glycolic acid or salicylic acid, are highly effective at dissolving dead skin cells and preventing clogged follicles. For those with sensitive skin, especially common in black skin, it's important to start with a lower concentration and increase slowly to avoid over-exfoliation, which can worsen irritation and hyperpigmentation. Once your skin is clean and prepped, the method of hair removal matters a lot. If you're shaving, always use a sharp, clean razor. Dull blades tug at the hair instead of cutting it cleanly, increasing the likelihood of hair breaking below the skin's surface and growing inward. Shave in the direction of hair growth, not against it, as this reduces the risk of the hair being cut too short and becoming trapped beneath the skin. Using a moisturizing shaving cream or gel can provide a protective barrier, allowing the razor to glide smoothly and minimizing trauma to the skin. If you prefer waxing, make sure the wax isn't too hot, as excessive heat can damage the skin and lead to increased irritation and inflammation. After waxing, avoid touching the area with unwashed hands and refrain from wearing tight clothing that can trap sweat and bacteria, increasing the risk of ingrown hairs. Regardless of your chosen method, moisturizing the skin afterward is vital. Hydrated skin is more supple and less prone to irritation. Look for fragrance-free moisturizers containing soothing ingredients like aloe vera, chamomile, or allantoin. For black skin, products containing shea butter or cocoa butter are particularly beneficial, as they provide deep hydration and help maintain the skin's natural barrier. Let's talk about specific treatments and products you can incorporate into your routine, especially if you're prone to razor bumps and ingrown hairs. After hair removal, applying a product containing salicylic acid or glycolic acid can help keep pores clear and prevent dead skin buildup. These ingredients work by gently exfoliating the skin on a cellular level, allowing new hairs to grow out unimpeded. There are also targeted ingrown hair serums on the market, often containing a mix of exfoliating acids and soothing agents like witch hazel or tea tree oil. These can be applied daily to areas prone to ingrown hairs. For those experiencing active razor bumps, applying a warm compress to the area can help reduce inflammation and encourage the hair to break through the surface. If a hair is visible just beneath the skin, resist the urge to pick or dig at it, as this can introduce bacteria and worsen scarring. Instead, gently exfoliate the area and allow the hair to surface naturally. If you're dealing with persistent or severe razor bumps, consider switching up your hair removal methods. Electric razors or clippers that leave a little bit of stubble, rather than cutting hair flush to the skin, can significantly reduce the risk of ingrown hairs. Some people find that abandoning shaving altogether and opting for depilatory creams or professional laser hair removal provides longer-lasting relief. When choosing depilatory creams, do a patch test first to make sure your skin won't react, as these products can sometimes be harsh, especially on sensitive areas. Laser hair removal is a more permanent solution, and advancements in technology have made it much safer and more effective for darker skin tones. Devices that use longer wavelengths, such as the NdIAG laser, are specifically designed to target the hair follicle without damaging the surrounding skin. If you're considering laser hair removal, look for a provider with experience treating black skin to minimize the risk of burns or pigmentation changes. Hyperpigmentation, or dark spots, is another common concern for black skin following ingrown hairs and razor bumps. To address this, incorporate products with ingredients like niacinamide, licorice root extract, or vitamin C, which help brighten the skin and even outtone. Avoid harsh lightening agents like hydroquinone unless prescribed by a dermatologist, as improper use can cause more harm than good. Consistency is key when it comes to preventing and treating ingrown hairs and razor bumps. Make exfoliation part of your weekly routine, moisturize daily, and use targeted treatments as needed. Avoid over-manipulating the skin and give it time to heal between hair removal sessions. For those with stubborn or recurring issues, seeing a dermatologist is always a good idea. They can recommend prescription-strength creams, such as retinoids or topical steroids, to reduce inflammation and speed up cell turnover. In some cases, oral antibiotics may be necessary if there's significant infection. There are also lifestyle factors to consider. Wearing loose, breathable clothing helps minimize friction and allows the skin to heal after hair removal. For facial hair, if you're shaving daily, try spacing out your shaves to give your skin more time to recover. Avoid products with heavy fragrances, alcohol, or other irritants that can dry out or inflame the skin. Natural remedies can also play a supportive role. Aloe vera gel, for example, is known for its soothing and anti-inflammatory properties and can be applied directly to the skin after shaving or waxing. Tea tree oil, diluted with a carrier oil, has antimicrobial properties that help prevent infection. However, always do a patch test with new products to ensure your skin doesn't react adversely. Education is a powerful tool. Understanding your skin's unique needs and how it reacts to different hair removal methods will empower you to make the best choices. Remember, what works for one person may not work for another, especially when it comes to black skin, which can be more prone to certain types of irritation and pigmentation changes. To sum up, preventing and treating ingrown hairs and razor bumps after waxing and shaving on black skin involves a holistic approach. Proper skin preparation, gentle exfoliation using the right shaving or waxing techniques, consistent hydration, and targeted treatments for both prevention and healing. Being gentle with your skin, choosing products formulated for your specific needs, and not hesitating to seek professional help when necessary will help you maintain smooth, healthy, and even-toned skin. By staying informed and proactive, you can say goodbye to razor bumps and ingrown hairs and embrace confidence in your skin every day.